أوكي، بسم الله الرحمن الرحيم. بسم الله الرحمن الرحيم. نستمر على Surgical Anatomy Abdomen. أوكي. على طريقة شنو؟ Questions and answers in surgery. What are the boundaries of gastrinoma triangle? What is gastrinoma triangle? What are the boundaries of gastrinoma triangle? Answer first. Third portion of duodenum. Second both hepatis. Third neck of pancreas. Okay. Neck of pancreas. These are the boundaries of gastrinoma triangle. What is gastrinoma? The gastrin secreting cell tumor. Gastrin secreting cell tumors. This is gastrinoma, okay? Another question. What's the advantage of midline incision? This is the abdomen. This is midline incision. What is the advantage of midline incision? Advantage of midline incisions. قبل يقولون big surgeon big incision. طبعا الآن اجى الميني سيرجري، ميني بورتس، ميني minimal invasive surgery، laparoscopic surgery. اوكي. بالكلاسيكال سيرجري big surgeon big incision اللي هو شو يسوي انه وايد اكسبوجر، good visibility، no major باعتبار midline incision، يعني هنا لينا قلبه no major vessel or nerve injury. مو مثل ما نسوي باراميديان، مو مثل ما نسوي كوخر مثلا. اوكي. What is the significance of arcuate line in the abdominal closure of midline incision? شنو قيمة الاركويت لاين؟ هنا arcuate line بنسوي closure بالانسجن. What is the importance of this arcuate line? Now below the arcuate line all the anterior and posterior layers شنو form one layer, but here in the upper and middle third nearly between the transections there is anterior rectal sheath and posterior rectal sheath which form from anterior oblique muscle and anterior layer of internal oblique muscle. This is anterior rectal sheath. Anterior rectal sheath. شنو؟ external oblique plus anterior split or anterior part of internal oblique. Posterior rectal sheath posterior part of internal oblique and شنو transversalis fascia. Okay. So the arcuate line, all three abdominal wall muscles fascia form the anterior rectus sheath fascia. كل المسلز بما في ذلك transversal fascia يصير anterior sheath. There is no posterior below this arcuate line. Okay, this is the importance. Okay, what are the major structural difference between jejunum and ileum? Major structural difference between jejunum and ileum. Major structural difference. Okay, this is has long vasa recta. Here short vasa recta. Okay, this is thicker wall, this is thinner. Okay, بعد البلايكي circularis are small. Small where brachicellulars here are thick and big. Brachicellularis thick here, thin. Brachicellulars. These are the difference between jejunum and ileum. Okay. What's the difference between anatomical difference between colon and small bowel? أكيد small bowel longer إنها shorter يعني تقريبا 200 سنتيمتر. longer. Okay. عندنا تيني كولي ما موجودة تيني كولي. بعد عندنا ابندسيس ببلويكة ابندسيس ببلويكة no appendices ابلواكي. نا عندنا هسترا no histration. These are the difference. What is the Hilton's line? White line. Hilton's white line. What is the Hilton's white line? Hilton's white line. What is the Hilton's white line? Between external and internal شنو؟ anal sphincters. Between external and internal anal sphincters. What's the space of Ryolan? Space of Ryolan. هذا وين يصير space of Ryolan؟ يصير بالavascular area in the mesentery, left to middle colic artery. This is the colon. Okay. This is the colon. And this is the middle colic artery branch. Here is the space where in the mesentery to the left of middle colic artery space اسمه Ryolan. طبعا هذا avascular space. Okay. We ask about the length. What is the length of anal canal? The answer is 3 to 3.5 centimeter. Rectum. The length of rectum, okay, 12 centimeters approximately. How the peritoneum cover rectum؟ نقسمها هالشكل هذا: upper third, middle third and lower third. How the peritoneum cover rectum. Upper third totally covered by peritoneum. Okay, this is the peritoneum. Or what we call the proximal third. Middle third anterior فقط, only anteriorly. This is middle third. The lower third شنو؟ No peritoneal covering. Okay. How we identify the zones of retroperitoneum? So retroperitoneal spaces contain all the structures that lie below the or behind the peritoneum, especially posterior peritoneum, what we call retroperitoneal structures. For example, kidney is a retroperitoneal structure. Aorta is retroperitoneal structure. And pancreas, part of pancreas is a retroperitoneal structure. Pancreas is retroperitoneal structure. And so on. So we have areas central area of retroperitoneal spaces. Central area. This is central area. Area number 1. On both sides, شنو? Left and right, there are retroperitoneal area. Here, nearly paracolic. In the central area, there is aorta and the vasculature underneath with the sympathetic chains. Apart from pancreas. Well, in the lateral areas, both area number 2, this is area number 2, this is area number 1, okay? And in the pelvis, area number 4. In the pelvis, area number 4. For example, the distal third of rectum is totally retroperitoneal. Apart from bladder is retroperitoneal, and so on. Okay. What's space of Ritz? Space of Ritz is thus. This is space between the pubis here. Here is the space between pubis and what? Pubis and rectum or vagina or prostate. Sorry, pre-peritoneal spaces between the pubis bone and the bladder, and space of Ritz between the pubis and bladder. Okay. Here is the space between pubis and the bladder. While denovular, what is denovular fascia? Between rectum and vagina or rectum and prostate. Denovular fascia to rectum, this is rectum, and vagina, or to rectum and prostate. So it should be here, denovular الاشياء. اوكي. واتس ماكنرودز ليجامنتس؟ سامعين بيه ماكنرودز ليجامنت؟ ماكنرود ليجامنتس is the cardinal ligament of uterus. This is McEnroe ligament, cardinal ligament of uterus. Okay. Okay. What are the boundaries of femoral triangle? Boundaries of femoral triangle. This is the thigh. This is a ligament, inguinal ligament. Here is sartorius muscle، عضلة الخياط، عضلة الرفاء. Here is inguinal ligament. This is the triangle. Okay, this is triangle. Femoral triangle. So this is the inguinal ligament, what we call babord ligament, inguinal ligament. This is sartorius muscle, and this muscle is adductor longus muscle. Adductor longus muscle. Okay, this is adductor. This is the inguinal ligament, or what we call femoral triangle. Femoral triangle. Where does external iliac artery become femoral? Where does external iliac artery become femoral? This is external iliac artery. When it passes just underneath the inguinal ligament, it becomes the femoral artery. Here is external iliac, and here is femoral artery. National external iliac. Okay. Where the superficial femoral artery become popliteal. هذا superficial femoral artery يصير popliteal، يروح below البوبليتيال فوسا. اوكي، حتى يصير بالبوبليتيال فوسا هنا. where femoral artery become popliteal. At the adductor hiatus, where the superior femoral artery leave adductor canal and turn into popliteal fossa. يروح للبوبليتيال فوسا. هاي الادكتر اللي هي سبسارتوريال في الحقيقة، هنا يلوف ويصير بوبليتيال. adductor canal. What's another name for الدكتال canal اللي هي نسميها هانترز. الدكتال canal نسميها هانترز canal. اوكي اللي يصير بيها الفيمورال ارتري يصير بيها بوب ليتيال ارتري. What's the another name of femoral triangle? This is femoral triangle. What's the another name? They called it scarbus. Scarbus triangle. Okay. We will continue on the questions and answers in surgery in order to make the surgery easy for you. Thank you very much.